Hello, and welcome to LGBT sex education and safe practices. The following slides will go over some of the fundamentals of LGBT sex education and ways to practice safe sex. Sexual orientation describes who a person is attracted to when looking for romantic or sexual relationships. Some of the more common sexual orientations include gay, which is when a man is attracted to another man, straight, when a person is attracted to the opposite gender or sex, lesbian, when a woman is attracted to another woman, bisexual, when a person is attracted to both men and women, pansexual is when you are attracted to many and all genders and sexes, and asexual, when you are not sexually attracted to any sex or gender. This does differ from being celibate or practicing abstinence. Gender identity describes how you feel about your gender and representation with your biological sex. Gender expressions are different from biological sex, and common gender identities are male, female, both male and female, or neither. Common expressions of gender identity are transgender, which is feeling different or opposite of your biological sex, cisgender, cis meaning the same as your biological sex, and non-binary, which is not exclusively male or female. Common pronouns for non-binary are they, them, and theirs. Now that we've covered some identity and orientation basics, we'll move into safe sex and what it looks like for different people. For lesbians, it is a common myth that they cannot receive or pass STDs or STIs. That is a false statement. Lesbians still come in contact with genital fluid, vaginal blood, and saliva, and mucous membranes, even when sex is not penetrative. Common STDs for lesbians include bacterial vaginosis, which is not confirmed to be an STD or an STI, but is more common among lesbian and bisexual women and can increase your risk of other STDs and STIs. Bacterial vaginosis is not confirmed to be able to be passed between people, but it is suspected, and it can cause vaginal itching, vaginal discharge, and foul odors. The herpes virus is a virus that causes sores and lesions around the genital area, the anus, and other areas of the body if the virus has come in contact with broken skin or open mucous membranes. Herpes can affect both men and women. Herpes is known by two different strains, herpes simplex 1 and herpes simplex 2. Type 1 is the strain that causes cold sores around the mouth but can still be transferred to the genital area, and type 2 is the strain that causes genital herpes. Trichomoniasis is caused by a parasite and can be spread by sexual contact or contact with contaminated objects and fabric. Signs and symptoms include yellow, green, or gray discharge, discomfort while urinating, and itching of the genital area. HPV, or the human papillomavirus, is the virus that leads to genital warts and abnormal cervical changes that can lead to cancer. HPV can be transmitted by skin-to-skin contact, hand-to-genital contact, or dirty sex toys. Syphilis, which is not commonly seen in society anymore, is caused by bacteria and is passed through direct contact with an open sore. Syphilis, when left untreated, can spread to other parts of the body, including the brain. Gay men are also still at risk for STDs. Some of the same STDs, such as herpes and syphilis, can be contracted and passed between gay men. Other STDs that gay men are at risk for are hepatitis B, which is a vaccine-preventable liver infection and is spread through blood, semen, and other bodily fluids such as saliva. Signs and symptoms of hepatitis B include fever, fatigue, nausea and vomiting, jaundice, and joint pain. Gonorrhea of the rectum and throat is spread through anal and oral sex and can cause painful and swollen testicles, white, yellow, or green discharge from the penis, and painful urination. It may also cause anal itching, soreness, and bleeding. Chlamydia of the throat and rectum is spread through anal and oral sex, and its signs and symptoms are discharge from the penis, pain and swelling of the testicles, rectal pain, discharge, and bleeding. HIV is another STD that disproportionately affects gay men and is transmitted through oral and anal sex and can also be passed when blood comes in contact with open skin or open mucous membranes. Pre-exposure prophylaxis, or PrEP, or post-exposure prophylaxis, PEP, are common pharmaceutical options that are used in preventing HIV, and you should speak to your doctor if there is a chance of you sleeping with somebody who has HIV, or if you already slept with somebody who has HIV. Tools for safe and enjoyable sex. There are many options available to help prevent STDs, STIs, and pregnancy. Female condoms prevent both STDs and pregnancy and are inserted into the vagina and placed around the outer genitalia. Male condoms are placed over the penis and can be used in prevention of STDs and pregnancy. Dental dams are latex squares used to prevent direct contact with the genitals, the anus, or other areas of the body. Diaphragms are inserted vaginally and do not prevent against STDs but do prevent against pregnancy. And finger cots and gloves, which are not a preferred method but still prevent direct contact with mucous membranes and sores. Many lesbians have or will sleep with men at some point in their life. Lesbian and bisexual women have a higher rate of teen pregnancy. Birth control options are available for both men and women to prevent pregnancy. The use of female and male condoms, which were discussed on the previous slide, can prevent pregnancy. Hormonal and non-hormonal pharmaceuticals such as the birth control pill, contraceptive rings, the Depo-Provera shot, and IUDs. IUDs come in both hormonal and non-hormonal options. There are also medical procedures available for both men and women and provide a permanent or semi-permanent option for birth control. Vasectomies sever the route of sperm, but not seminal fluid, so ejaculation can still occur and is oftentimes reversible. Tubal ligations are a surgical method for women in which the fallopian tube is severed or tied off to prevent eggs from traveling to the uterus. Tubal ligations have come a long way and can be reversible, but it is less common for reversal to be effective. When using toys with a sexual partner, it is still important to practice safe sex because many viruses or bacteria can survive on different surfaces. Using condoms or female condoms with vibrators, dildos, and other penetrative toys can help prevent the transmission of STDs. Using proper cleaning methods, as recommended by the manufacturer, is crucial. You should clean your toys before and after any sexual encounter, and different materials require different cleaning methods. Some you can put in the dishwasher, such as glass or silicone. Rubber should be cleaned with antibacterial soap and warm water, and fabric should be put in the washer and dryer. Anything with an electrical component should be cleaned using manufacturer's instructions, and there are also many commercial cleaning products that can be used. Kink is a vague term used to describe non-conventional sex. It can involve roleplay, restraints, fetishes, power dynamic changes, and other scenarios. It is important when practicing any sexual encounter that communication and consent are present. When trying something new with your partner, an open line of communication is key. Setting limits, come up with safe words, and discuss emotional aftercare. Make sure that you are using non-elastic restraints and that restraints are not too tight. Nothing is cutting off circulation or airflow. Get comfortable with knowing your limits and communicating them, and remember that anything other than yes, I want to, absolutely, is not consent, and consent can be revoked at any point. Thank you for watching, and remember that sex can be fun, exhilarating, and adventurous while being safe and responsible.